Hi, Haley. It's Josh, one of the Rudy doctors.
Hi, Josh. I'm up in GitGat today, and I just had a patient present. I'm wondering if you got a space for a consult.
Absolutely. Happy to help. What can I do for you?
The further remote you go, the less resources you have at your disposal, both, again, from people or medical supplies and so forth. That's a pretty daunting scenario to find oneself. And so the idea is to provide that reassurance,
Can I give you a call back if anything changes?
that support that is both real time, but perhaps just in your pocket, so to speak, providing they have the technology, meaning the connectivity to make the call. The wins are numerous. Delivering a baby in a community that hasn't had a baby delivered in it for, a few decades is pretty transformative.
COVID really propelled us to kind of be more creative and innovative, and now communities that are really isolated and removed have access to consult, are able to just pick up the phone.
Do you have a Red Cross close by, Roberta?
Yes, I do.
It's really changed how we deliver care to our patients.
Are you able to help in the workspace?
Yep. We are the largest rural health authority. We serve about 300,000 people in British Columbia and 55 First Nation communities. So there is a ton of people that we are supporting and very limited supports in a lot of those communities. So we really were just trying to build out a team that had strong influence within the North, strong understanding of how Northern communities work, and then helping to kind of step in and support that population.
Calling from the Northern Health Virtual Clinic. Congratulations on your new baby.
And not just for the patients, but for our healthcare providers too, who are at full capacity, experiencing burnout. With the peer-to-peer, we have our resource nurses. So I'm one of those resource nurses. We have 5 in total, and we each kind of have our own specialty area. Our hope is that people can reach out and maybe in those smaller rural remote communities and say, hey, I'm not super familiar with this piece of work. This is a client I have. Can you help me through this?
We have peer pathways for obstetricians, we have it for pediatricians, for emergency physicians, for critical care. It enables physicians in these communities to have access to specialty advice.
Remote First Nations communities in our province unfortunately represent the group with the hardest ability to access care and support. They've driven the innovation, they've driven the normalization of the integration of technology at the bedside.
That includes First Nations virtual doctors of the day, substance use and psychiatry, to ensure that they have access to a GP.
Let me just transfer you to Dr. Today.
Individuals across the province, First Nations people, have told me that this has really been an important development for them, and that they really feel comfortable in using a service that is essentially their service. There's been some analogy to having a seat at the table. Well, I would say some of these services are actually providing the table.